the years, MS TeamWorks has shared perspectives on MS from all members of the MS team. And although 2020 brought unexpected challenges, we were determined that a pandemic and social distancing would not stop us from sharing new and meaningful perspectives. The setting was different, but the message is the same. I have MS. I have a team. I have a future.
Hi, my name is Denise Bruin, and I'm an adult nurse practitioner who specializes in treating people living with multiple sclerosis. For the past 10 years, I've worked in a multidisciplinary MS clinic at a large academic center. Some of the most common chronic conditions that we see in our people living with MS sometimes can be related to having MS, such as depression or neuropathic pain. But certainly we also have patients that are living with hypertension or diabetes, migraines. So often we have to figure out what is their MS and what is something that we need to have their primary care doctor be seeing them for, and how do we collaborate together to give them the best care possible. So one of the things that we often encounter when people are first diagnosed with multiple sclerosis is what symptoms or what's going on with their body that they need to contact us, as it could be related to their MS, and what is related to other chronic health issues they might be dealing with. So a lot of times it's asking the right questions, making sure we're doing the right testing, having that relationship with patients that they can be open and tell us what's going on. And that everything is not from their multiple sclerosis, and how do we figure that out? Oftentimes a patient might go to the emergency room for a totally unrelated condition or issue, and as soon as they mention they have multiple sclerosis, everything gets kind of blamed on that diagnosis, even though it might have nothing to do with their MS. So this can be very frustrating for patients where they feel they're not heard. And this is oftentimes where we really have to educate patients so they can advocate for themselves that something seems different, that it's not just from their MS. This is also where we try to educate their primary care doctors as to what we feel would be for multiple sclerosis and what might be something we need to investigate further. I recently had a patient who he's been living with MS and doing quite well for about the past 7 years. And he came to me because he was having a lot of pain in his hands and his feet, and they felt very tight and swollen. This was something that didn't really fit with his symptoms previously from his multiple sclerosis. So we did some blood work, and it turns out that he has diabetes and his blood sugars were quite high. And that was actually what was causing kind of that swelling and pain in his joints. And once we were able to get him in with the right provider and treat that symptom got better and went away. So again, it's advocating for patients that not everything is going to be related to their MS. Other things can be happening too. So when patients have more than one chronic condition, we often have to collaborate together. Since I work in an academic facility, I often am either reached out to or I reach out to those other specialties. Sometimes it's reaching out to their primary care doctor as to, we're going to start them on a certain therapy. What vaccinations do you recommend that we give them? And ideally, we would do that before starting their therapy. Some autoimmune issues run together. So we work closely with endocrinologists if there's thyroid issues. I have a few patients that also have Crohn's, so it's dealing with their gastroenterologist and what that treatment looks like. Best case scenario, we can find one medication or one therapy to treat more than one condition, to give the patient kind of the most normal life possible, that they're not taking multiple medications and dealing with side effects, that we can all be on one page, giving, again, the patient the best care possible, but safely too. Because patients come to us when they're first having symptoms of multiple sclerosis. Again, MS affects younger people, so many times they haven't really been involved in the healthcare system because they haven't had a reason to seek medical care. So we uncover a lot of other issues that the patient had but hadn't realized. So I have a young man who, he has MS. It was pretty aggressive. His mother has MS as well. So when he started having symptoms, he was a little bit more attuned to what he might be dealing with. And the therapy that he was on required that we check blood work pretty frequently. And we had noted that some of his electrolytes were very off and not what we expected from the medication he was on and not what we expected from this young, otherwise healthy man. So more testing was done, and it turns out that he had a very large tumor on his liver. So that had nothing to do with his MS, but we were able to identify that, get him into care for that, and then again work with his oncologist to figure out how do we treat his MS and how do they treat this liver tumor and how do we work together again so that things are as stable as possible and not putting him at more risk on either side, either with this cancer or with his multiple sclerosis. And he's doing quite well. As new medications come out or he has other symptoms, we have to continually have a conversation with each other, the providers, to make sure that, again, we're all on the same page in giving him safe care. The first thing that is often troublesome for patients is how do they find a primary care provider in their area that even understands MS? That's kind of the first thing. So for myself, knowing who's in my area for patients to tap into that understand what it means living with MS and what are some of the special challenges that might come with living with MS is really important. The MS Society can be a great resource to reach out to ask that question, especially if you're moving to a new area. Word of mouth is a great thing as well. So joining local support groups and asking, who do you see for your primary care doctor? And to me, that relationship would mean if the patient had a new symptom and I didn't think it was from their MS, that their primary care doctor would understand why I wanted them to get in to be seen quickly, and again, not just to blame everything on their MS. Or for our patients that live a distance, if I thought they were having like a pseudo relapse and there was certain testing I wanted, that the primary care doctor could understand why I'm requesting that lab work and that they can assist me with getting that so the patient doesn't have to wait. And also so that patients don't have to access the emergency room unless absolutely needed, which often happens because patients don't have a primary care doctor or can't access them quickly. So then they're using those resources, which is not always the best use of the emergency room if they can get into their primary care doctor for a simple evaluation of things, especially in this day and age. We're trying to keep people out of the healthcare building as much as possible, unless we actually have to, just because of exposure with the pandemic. I also would like that primary care doctors reach out to me if they're seeing the patient in clinic and the patient reports something that they're concerned about, that the relationship goes both ways, that they feel they can pick up the phone or send me an email and say, hey, Mrs. So-and-so is reporting this, what do you think? So again, it goes both ways so that it gives holistic care to the patient. I think the most important thing for my patients living with MS is remembering that other things can still happen, to advocate for yourself when something does not seem correct in terms of your symptoms or how you're feeling. And I also think it's really important to have a close relationship with your primary care doctor. A lot of our younger folks that are diagnosed are transitioning between a pediatrician and an adult healthcare provider. So knowing who they can go to, again, vaccinations, what other health issues, and that if we do find something else, just with all the testing we do, that they're not waiting months to get in as a new patient, that they already have established care. Preventive medicine is important. I think that's the main thing, is that, living a healthy life regardless of a chronic condition, is something that I want all my patients to be able to achieve.